Hello, my name is Anna Tabet, and today I'll be talking about the AUDIT tool, which is Alcohol Use Disorder Identification Test in primary care clinics to reduce alcohol misuse. Background about alcoholism. According to the Center of Disease Control and Prevention, there was a report conducted in 2010 indicating that there were 88,000 deaths each year due to alcoholism. It is the third leading cause of death in the United States. There have been many social issues associated with alcoholism, which include homelessness, increased illegal activity, and mental health issues that have evolved because of alcoholism, or the patient self-medicates to take care of his mental health issues, such as hearing voices, feeling anxious, or feelings of depression. Hypertension, and cardiac problems. These are to mention a few. Excessive alcohol consumption in the U.S. has an estimated cost of $223.5 billion. This is a huge industry. It's economically fatal to our families, to the patient, and to everybody who is touched by this patient, his employer, the children's school, even relatives. This is economically fatal. Consequences of alcoholism include loss of work, increased healthcare expenses, usually when a patient is misusing alcohol. Consequences of this are comorbidities that occur hand in hand with alcoholism. Legal issues. Alcoholism is very expensive, especially if you become involved in the legal system. If there is a DWI, you can hurt somebody, you can hurt yourself, you can kill somebody or kill yourself. Police officers will usually pull you over, do an alcohol concentration test or BAL, and if you fail a sobriety test or they feel that you're under a substance, they take you to jail. There, you have a choice either to hire a legal representation or to maybe get a relative to take you out of jail. But you will still be going to court to take care of some issues. And usually you lose your license. And to retain an attorney is usually a minimum of about $10,000. So a lot of people don't take this into account. That taking one drink could change your life and your family's life forever. There's also increased motor vehicle costs and impaired driving. Pregnant women should occur in the primary care provider's clinic. Screening them can identify high-risk behaviors of alcohol misuse. Harmful behaviors can also be identified and can be addressed before harmful behaviors develop. Also, before addiction develops. So why should we use the AUDIT screening tool? It's a simple method of screening for excessive drinking and to assist in brief assessment, to identify excessive drinking as the cause of the presenting illness, and to provide a framework for intervention to help risky drinkers reduce or cease alcohol consumption, and in the long run, avoid harmful consequences of their drinking. This tool will also help identify alcohol dependence and some specific consequences of harmful drinking. There's also a manual that comes with this tool, and it's designed for healthcare practitioners and a range of healthcare settings, but with suitable instructions. It can be self-administered or used by non-health professionals. Screening for alcohol consumption among patients in primary care clinics may have potential benefits. So there are many potential benefits. It provides an opportunity to educate patients about low-risk consumption levels and the risks of excessive alcohol use that can be addressed immediately in the primary care office. And interventions will be started. Information about the amount and frequency of alcohol consumption may inform the diagnosis of the patient's presenting condition, and it may also alert clinicians to the need of it to advise patients whose alcohol consumption might adversely affect their use of medications and other aspects of their treatment. Again, we know that alcohol does not do well with medications in the body, and many people don't realize that one is not to drink alcohol when they are treated by a physician. All kinds of issues can occur, even death. So patients need to be educated on this. The screening also offers the opportunity for practitioners to take preventative measures that has been proven effective in reducing alcohol-related risks. Universal in multiple countries. It identifies harmful alcohol use and possible addiction. It's fast, flexible, and designed for primary care clinics. And its emphasis is only on recent alcohol use. There are some barriers associated to conducting the audit screening tool in the primary care setting. According to research, many providers minimally perform this alcohol screening tool, because of lack of time. Time is priority for these providers. They would have 30 to 40 patients per day, and they would state that they did not have time to carry out these screenings. They also felt that this screening may jeopardize the provider and patient relationship. They didn't want their patient to feel like they could not trust their provider. Many times the patient would be offended by the questions that were asked. Also, follow-up is rarely done. This is a huge barrier. There's not enough training, or perhaps the educator on the floors or in the clinics are not providing enough education for their patients. They're not following protocol, and follow-up has to be done. Interventions are not properly given. This is essential. Interventions must be given, or patients must be followed up with the proper resources. Drinking behaviors and alcohol-related problems. That on your free time, I hope you get a chance to look at that shows you the audit 10, which has 10 questions, and also shows you the cage, so you can compare and contrast the differences. Here's an example of 10 questions. It's specific for recent drinking, and if you look below, there's a score system. This will dictate to you whether you need to do any kind of interventions for your patients. In a research study by Zavar, Jahari, Amrati, and Khosravi, there were 70 individuals with alcohol use disorder that was considered the study group, and 70 non-alcoholic individuals that was considered the control group. Persian audit was completed for all participants. Remember that the audit is universal and is translated in many languages. So for this study, the explanatory factor analysis was used to construct validity. The reliability of audit was determined by examining internal consistencies and retest reliability. Results indicated for this study that the correlation of retest results was statistically significant, of R equals to 0.711 and P equals to 0.020. That is below 1. Using the ROC curve at the cutoff point of 8, a specificity and sensitivity of 89% and 99% was achieved for the test, and the accuracy of the area under the curve was achieved to be 99%, or P is less than 0.001. What does this mean? This simply means that there is less than a 1 in a 1,000 chance of the stated result being incorrect based on observed error. It means that the result was statistically significant at the probability level. If you look at these results, they are very significant and they're very sensitive, and specific. Specificity, it can be used as an effective instrument for identification of alcohol use disorder for high risky drinkers and early detection of alcohol addiction. There were some additional studies that are researched, a study by Orr, Macaulay, Graham, and McCord, created a pilot study that was conducted in 3 local authority areas in Scotland. The audit screening tool, which is the gold standard for alcohol use, was utilized. In this study, the author felt the staff needed to understand how to follow up data and how to educate the staff. Again, this is universal. Not only are we having problems in the United States, but we are having problems worldwide on how to teach and train our staff that will be administering this type of screening. Yet another study by Tan, Hungerford, and Denny and McKnight indicated that the U.S. Preventative Service Task Force has recommended that primary care providers screen all adults and implement some brief counseling. This author recommended that providers should utilize suitable screening tools that will allow providers to better identify patients with alcohol misuse behavior so that proper intervention could be implemented. These patients must be helped. There are many high-risk patients that are drinking and that are unaware that they could be developing an addiction. An addiction can lead to many consequences, health consequences, and mental health consequences, as well as emotional problems and family issues. A study by Lee, Jung, and Choi indicated that their research was conducted to explore the abbreviated version of the audit. There is a newer version called the STAD, which is a screening tool for at-risk drinking for the young and middle-aged adults. Authors felt that it is imperative that we understand that there are different versions of the audit screening tool. I did come across different versions, more of a compressed version, which is the audit C. There was an audit that had 3 questions, and there were several other screening tools, for example, the gauge. But I felt that the audit 10 was more comprehensive and was more efficient, and you became more comfortable understanding the patient and where they came from. So it provides you more information on how the patient feels. We need to capture these patients before they fall through the cracks. We need to implement and help save them. We need to teach them and educate them and intervene. Screening tools of the Audit C for at-risk drinking in Australia. Interestingly, the provider was heavily influenced by social cultural factors such as the stigma of alcohol dependence, unreliable patient alcohol use histories, and the threat of patient-doctor relationships. This seemed to be huge in Australia. Doctors did not want to offend the patients, providers didn't want to offend their patients, and they wanted to keep their trustful relationships going. So this was very big for some cultures. In Romero, Perula, Neva, and Fernandez, and finally Barras, this study evaluated the knowledge, attitudes, and practice of providers and nurses in a primary care clinic in Spain for Spanish-speaking professionals. Yet, this study indicated that, again, the screening was not done properly, the education and interventions were not done properly. We need to properly train our educators in our clinics. We should train our medical assistants that after they vitalize the patients, they should be screening our patients for high-risk drinking behaviors. After the educator or the medical assistant screens our patients, the next step is to provide the result to the physician. That would be to enter them into the EMR or to give the physician the screening tool so that they can assess it and discuss it with the patient. It is very strongly encouraged the medical assistant is familiar with following up with the patient at 3 months, at 6 months perhaps, or even sooner. This is one problem, is that medical assistants or whoever is providing the screening tool in current clinics are not following up. Thus, again, we lose our patients, possibly even to addiction. Implications for practice. The audit is the hallmark for identifying high-risk patients with who misuse alcohol. There are many overlapping mental health issues that may be masked by alcoholism. This allows the mental health nurse practitioner to establish rapport with the patient, learn to understand the patient, and learn to figure out what symptoms are overlapping what. There are many similarities between alcohol withdrawal symptoms. The patient tends to feel anxiety, sometimes depression and sadness. So we have to identify we have to tease out which came first. Was it the anxiety and depression? And then the client chose to medicate themselves with alcohol? Or was the anxiety and depression a result of the alcoholism? This is what needs to be established with the mental health provider so that they can become familiar with the patient and promote proper management and treatment of this patient. A psychiatric mental health nurse practitioner needs to be able to identify these symptoms and take very elegant notes on these patients, because when they become sober, they can establish a rapport and she can tell the patient initially how they came in and how their goal is, if their goals are being reached, and if there is any improvement. And again, this is an opportunity for the PMHMP to develop a trusting relationship and understanding of the patient. Conducted by the Center for Disease Control in 2010 indicated that there were 88,000 deaths. Again, it is a third leading cause in the U.S., and it contributes to many healthcare problems, mental health problems, and economical problems. The U.S. Preventive Task Force has recommended that the alcohol screening should be performed in primary care clinics. However, they could be performed in other settings as well. One of the issues for providers not utilizing the audit screening tool was because, one, they had lack of time. Two, they felt that it would jeopardize the provider-patient relationship, and they wanted their patients to trust them. So they didn't want to put their patients in an awkward position. And third, those who did administer the screening tool did not administer it properly, and they did not follow through. The L10 screening tool is very beneficial. It is available to identify high-risk behaviors and could help the patient at risk. Will help them by providing education for them and interventions to prevent alcohol misuse and prevent an inception of an addiction. Thank you very much. I hope you enjoyed this presentation.